When we think about improving safety in healthcare, we often focus on fixing mistakes. But what if real insights come from what we are already getting right, which happens more frequently? Let's see how recognizing moments of excellence can lead to lasting improvements with SHOT ACE. ACE stands for Acknowledging Continuing Excellence. It is a way for lessons learnt from excellent practice in transfusion to be collated and shared. SHOT ACE was first mentioned in the 2019 annual SHOT report, and from 2021 onwards, organisations have been able to submit ACE reports. It's easy to do. Organisations can file an ACE report just like they would with incident reports. These are summarised and discussed further in the annual SHOT report. What exactly is SHOT ACE? It's all about recognising exceptional transfusion practice, where a team or department goes above and beyond their routine practice. The best part? These cases come with lots of learning opportunities for everyone. Learning from what we do well gives us new opportunities to improve. It helps us build resilience, provides positive reinforcement, boosts staff morale, and ultimately supports a more complete approach to patient safety. A strong safety culture is key to preventing transfusion incidents, which directly keeps patients safer. It also helps foster great leadership and teamwork, where staff feel safe to speak up, included, trusted, and respected. This kind of culture is all about having a shared vision, being open to learning, having a growth mindset, and supporting each other. When we learn from excellence, it doesn't just improve care for one person or one team. It has the potential to influence practices on a bigger scale across regions, or even nationwide. Sharing these success stories can create a huge ripple effect and drive major changes. Patient safety systems, like traditional reporting, usually focus on what goes wrong. That's the Safety 1 approach, which is crucial for improving healthcare. There's also another way, Safety 2. This approach looks at what goes right and how safe care happens, giving us a fuller picture. This means we need to understand not just mistakes, but also how frontline staff handle complex situations every day, adapting and delivering excellent care. By using both Safety 1 and Safety 2 approaches, we can learn from what goes wrong and what goes right, helping us improve patient care across the board. To learn more about Safety 1 and 2, check out the SHOT video, A Holistic Approach to Transfusion Safety. Let's see two real-life examples of SHOT ACE. A healthcare assistant in passing noticed an agency nurse taking 2 blood samples at once, which isn't safe practice. When asked about it, the nurse said they planned to label the sample tubes with different times. The healthcare assistant reminded the nurse that samples should be taken at different times by different people. The duplicate sample was safely disposed of and the near miss was reported locally. This quick action not only prevented a potential error, but also became part of the hospital's training program to ensure it doesn't happen again. Another case occurred in the transfusion laboratory. A biomedical scientist spotted a wrong blood in tube error by checking the patient's hematocrit from a different blood test sent earlier in the day. They compared it against the appearance of the other transfusion sample received, and these didn't match. Since the patient hadn't had a previous group and screen sample, this catch prevented incorrect samples from being processed and the wrong blood group being recorded in the patient's file. It also helped avoid delays if blood components were needed later in the transfusion process. Following this incident, several improvement measures were implemented across the organisation. Want to boost learning from excellence in your organisation? Here are some ideas. Use appreciative inquiry and investigations, meetings and debriefs. Try safety huddles, proactive observations and team simulations. Educate staff about Safety 2 and how it works with Safety 1. Include Safety 2 in your improvement plans. Check how staff feel about adding Safety 2 principles and how it affects the organisation's resilience. Check if your organisation has a way to report excellence and participate. If not, why not start one? You also can foster a safer culture by looking at what went wrong and what went right. Combine Safety 2 with Safety 1 approaches to address the gap between work as imagined to work as done. Paying attention and capturing everyday successes and excellent events improves safety. It highlights the true quality and strength of your service. Remember to capture, learn and report, and be ACE.